Centuries before modern medicine, when surgery was feared and the human body was still a mystery, one man dared to look beneath the skin, to map muscles, bones, and nerves with astonishing precision. In the year 1000 AD, he wasn't just a doctor, he was an inventor. He designed surgical tools from scratch, performed operations that saved lives, and wrote detailed medical texts that shaped the course of medicine for over 500 years. Yet today, his name is barely mentioned. He was a pioneer in a forgotten age, an unsung genius who helped build the very foundation of modern surgical science. You're watching Knowledge and Facts, where forgotten geniuses and untold discoveries come back to life. We've all heard of Da Vinci's anatomical sketches, of Hippocrates, the father of medicine, Galen's theories, and Vesalius's anatomy charts. But what if the true pioneer of surgical precision came centuries before them all? His name was alzahrawi, known in the West as abulcasis, a 10th century physician who didn't just write about medicine. He practiced it, mastered it, and taught it with unmatched detail. He designed over 200 surgical tools, performed complex procedures, and laid the groundwork for modern surgery. So why is his name barely mentioned in medical history today? Let's uncover the forgotten genius behind the scalpel. Let's journey back over 1,000 years to the city of Cordoba, the shining jewel of Islamic Spain. It was the 10th century, a time when Europe struggled through the Dark Ages. But here, knowledge flourished. In the bustling streets and brilliant halls of learning lived a man whose brilliance would echo through the centuries. Alzahrawi, physician, surgeon, inventor, teacher. He wasn't just another scholar, he was a revolutionary. At a time when surgery was feared and the human body was more myth than science, alzahrawi dared to do the unthinkable. He believed medicine should be rooted in observation and hands-on experience, not in superstition. While others hesitated to cut, alzahrawi stepped forward. He treated wounds, reset broken bones, and performed surgeries with techniques no one had ever documented before. But his true legacy lies not only in what he did, but in what he left behind. His life's work, Al-Tasrif, was a 30-volume medical encyclopedia. It covered everything from diagnosis and treatment to pharmacy and nutrition. But it was the final volume, focused entirely on surgery, that became a masterpiece. In it, he detailed surgical procedures step by step, illustrated over 200 instruments of his own design, and emphasized safety, hygiene, and patient care. These instruments would go on to inspire medical tools still in use today. For centuries, Al-Tasrif was used as a medical textbook across Europe and the Middle East, guiding doctors, training surgeons, and shaping the very foundation of surgical science. Long before modern hospitals and sterile gloves, there was Alzahrawi, a man who saw the human body not as something to fear, but something to understand, heal, and improve. In this section, Alzahrawi described surgical procedures in incredible detail, from setting bones and removing tumors to treating dislocations and performing cauterization. He created and illustrated over 200 surgical instruments, many of which resemble modern tools used today. Scalpels, forceps, retractors, surgical hooks, all crafted from his designs. Even more impressive, he was the first to describe internal stitching using catgut, material that dissolves naturally inside the body. He emphasized patient aftercare, clean procedures, and pain reduction, concepts that wouldn't be standardized in Europe for another 800 years. His book, Al-Tasrif, was translated into Latin in the 12th century and became the go-to surgical text for European doctors for the next 500 years. Even famous surgeons like Guy de Chauliac cited him as a primary source. Alzahrawi was centuries ahead of his time, a scientist who believed that medicine should be shared, practiced, and constantly improved. So why don't we hear about him today? Because history, more often than not, is written by those who hold the pen. And many voices from the Islamic Golden Age were silenced, untranslated, or forgotten in the Western canon. While European scholars were rediscovering Greek texts, Al-Zahrawi's groundbreaking contributions were already changing the face of medicine across the Muslim world. But time moves on, empires fall, and manuscripts are lost. Yet today, Al-Zahrawi's legacy is resurfacing. He is being remembered not just as a medieval doctor, but as a visionary who turned medicine into a science of precision. He showed that healing wasn't just spiritual, it could be surgical. That knowledge must be preserved and passed on, and that the human body is not a mystery to fear, but a system to understand. Al-Zahrawi wasn't just a doctor, he was a pioneer, a teacher, and a bridge between ancient knowledge and modern medicine. If you believe more people should know his name, share this video, leave a comment, and subscribe. Here at Knowledge and Facts, we bring forgotten geniuses back into the light, because the future is built on the dreams of those who came before. And next up, we'll explore the mind of an inventor who built early robots and automated machines, 1,000 years before the Industrial Revolution. Until then, stay curious and keep exploring with Knowledge and Facts.